Access to clean, safe and nutritious food is a general concern for many low-income families, with food insecurity affecting an estimated 73 million Africans. Now, what will the additional challenges brought on by COVID-19 pandemic mean for food security on the continent? We'll find out how a young Somalian is taking matters into his own hands as he tackles the problem of a lack of ventilators in his home country. And on the bright side, a global pandemic is no excuse for not being stylish. We'll look at the latest marked trends. These and other key news from the African continent to come. So Jumbo, Dumela and welcome. I am Dumelo Mototwane and this is #Africa. The World Health Organization is concerned about the potential impact of COVID-19 on food security. While there has been little research into malnutrition as a comorbidity for COVID-19, recent estimates have suggested that food insecurity affects as many as 73 million people on the continent. Now, could COVID-19 worsen the already considerable burden of malnutrition in Africa?
Rosemary Pamire struggled to feed a family well before Zimbabwe entered a lockdown in March to try to combat the new coronavirus. She can hardly put together a meal a day as the Southern African nation faces a deepening food crisis.
Sadza ratadya iri takaribika nezuro manheru. Upfu wakabva wapera, mafuta akabva apera, soti zvese zvakabva zvapera, pasisina. Takabva tangodya kadiki diki tikasiya kuti tigozokwanisa kudya nhasi. Ndiro ratadai kudziisa iri kuti tidye, tangoridya rakasangana nemavheji risina kana nyama. Nyama takapedzera kuidya kare kare. Amenoti nhasi tinodya, hatina kana chekubata nhasi. Zvakandiomera, so ndichararama sei muupenyu hwangu.
Zimbabwe's finance minister has warned foreign lenders of worsening food insecurity if the country does not get financial help to fight the coronavirus. The United Nations Food Agency says coronavirus is the reason many are facing food shortages.
Sikukwanisa kudya kamwe chete pazuva. Mhuri yangu haisi kuguta nokudya kamwe chete kwairi kuita. Dai ndiri kushuvira kudai hurumende yedu yakwanisawo kutipawo chikafu, vanhu vakwanisawo kudya vachiguta.
Pamire is a mother of 4 children and 2 grandchildren who gets her money from the reselling clothes and shoes. But now that the borders are closed, she struggles to feed her family. Pamire's 2 adult sons cannot help their mother because the local market where they work has been shut down for 6 weeks due to COVID-19.
Upenyu hwatiri kurarama iye zvino hwakaoma. Handizivi kuti ndotangira papi. Ndosaka ndakatuma Ana kuti aende kutengesa mafree seeds kuti akauya nemari tigowana kurarama tisafe nenzara, tigokwanisawo kutenga muriwo kuti vawanewo kudya vachiguta.
The family now relies on Pamire's 19-year-old daughter, who sells ice lollies and bottled water at their local market. On a good day, Anna sells a packet of ice lollies for 110 Zimbabwean dollars. After buying new stocks, only $1 is left for the family of 7 to buy food, including the staple maize meal, sugar, and cooking oil.
Dzimwe nguva mumba musina hupfu, tisina kutengesa mushe, mafriziti. Mama vanongoti torei mafriziti nemvura timwe tobva tarara, vachiitira kuti mangwana pamwe tingatengesawo zvakanaka.
The World Food Programme says 7.7 million Zimbabweans, half the population, need food aid after a devastating drought and cyclone in 2019 and patchy rains this year.
As hospitals across the African continent are facing disastrous shortages of life-saving ventilators, a 21-year-old Somalian inventor has taken it upon himself to build a prototype after a man from his hometown died from COVID-19 due to a lack of ventilators. Now, as hospitals across Africa are facing disastrous shortages of life-saving ventilators, a 21-year-old Somalian inventor has taken it upon himself to build a prototype after a man from his hometown died from COVID-19 due to a lack of ventilators.
Mohammed Adawe is on his way to a Mogadishu hospital to test out his prototype. After hearing about a man who died of COVID-19 because he didn't have access to oxygen or a ventilator, the 21-year-old inventor decided to build his own.
I swear in the name of Allah, the situation in the country and coronavirus is very critical. People are dying of coronavirus and a lack of oxygen because there are very few ventilators in the country.
Somalia has one of the highest coronavirus death tolls in the region at over 50 and more than 1,000 cases. At the same time, the country's healthcare system is ill-equipped to deal with the pandemic. There are only 19 ventilators available for a population of around 15 million.
What we need for the time being urgently.
Health Minister Dr. Fawzia Abikar Noor says the situation is urgent and has praised Adawe for stepping up at the critical moment for Somalia. As for the inventor, he's asking for help. Though his ventilator is a basic concept, in a country where most hospitals only have handheld oxygen pumps, he's convinced his homemade machine can save lives. Adawe says he could make 20 more, but he doesn't have the financial means.
And moving to the east now. There is only one skilled respiratory therapist in Ethiopia, and he is on a desperate mission to pass his knowledge on to other health professionals in that country.
Habtamu Kahali's expertise is suddenly in high demand. He is Ethiopia's only respiratory therapist, and therefore the country's only expert in using a ventilator. As the coronavirus epidemic gains a foothold in his country, Habtamu is now rushing to train others to use the machines that could mean the difference between life and death.
If they are not properly applied to the patients, the risk may be more than the benefit.
From throughout the country on the...
Ethiopia's health minister says the country has around 435 ventilators with plans to buy more, and that around 800 health professionals could operate them. But Habtamu says only very few have the necessary specialist skills.
We can see that from the trainings, we can see that there is a significant gap in the application, the clinical applications of this machine. So I could say that the gap is very high, so we're trying to narrow that gap by giving these very brief short-term trainings in line with this COVID-19 disease.
He's been touring hospitals to check their levels of preparedness, and since the end of March, he has put 78 health workers through 2 days of training, condensed from an original one-week course. Ethiopia has 250 confirmed cases of the disease, a tally that has almost doubled over the past 8 days. The World Health Organization says around 5% of COVID-19 infections are severe enough to require intensive care and mechanical ventilation.
Up next, Africans are forced to scale back on funerals in the name of health and safety, and how has the pandemic affected the online food delivery sector? Find out when #Africa continues. This is #Africa. Now, governments across the continent are imposing harsh restrictions on practices around funerals and burials, foregoing many cultural traditions in the name of health and safety. But among them, a limit on the amount of mourners who are not allowed to attend what is seen as last payment of respect to the deceased.
Mourning a metre apart. That's the rule a funeral service in Johannesburg has had to put in place to adapt to social distancing measures intended to keep guests safe. But for some, it's not quite the send-off they had imagined for their loved ones. Maki Modemola came to mourn her sister.
I'm a bit saddened that, her life wasn't celebrated by the people who knew her.
At the moment in South Africa, only 50 people are allowed to gather at funerals. Chairs are now spaced out and a single sound speaker replaces a choir. And rituals like night vigils on the eve of burial and the washing of bodies by family members have also been banned. Funeral directors like Monaghan Lagai have scrambled to meet the new regulations while respecting customers' wishes.
For us as a funeral provider, our business is a word of mouth business. So when I do a burial at the Hlongwane family, I am really hoping that the people attending see the way that we render the service. Now with the 50% attendance that has been cut down, now you find yourself that you're not having that exposure.
He added that soldiers are sometimes required to carry out head counts at cemetery gates in order to control the number of attendees.
Back on home soil now, South African communities and commuters are now required to walk through elaborate sanitizing booths before boarding public transport, all in a bid to help fight the spread of COVID-19.
Commuters boarding buses in South Africa's Soweto township had to put up with a mild soaking on Thursday as authorities trialled a disinfectant booth. Africa's worst affected country is tentatively easing one of the world's strictest lockdowns as it tries to balance health concerns with devastation to its shrinking economy and mostly poor population. It's hoped the metal arches equipped with a plant-based germicidal spray can help. Scientists around the world have cast doubt on the effectiveness of mass disinfection, but in Soweto, a quick walk through the fog appeared to give residents like Bright Shabani peace of mind.
As long as they're trying to protect us, I'm happy as long as they are trying to sanitize it. But it shows something that they are doing something.
The booths were made by Real African Works Industries, which manufactured buses before the lockdown. They cost up to 120,000 Rand, or around $6,400, and are also equipped with thermal cameras to scan temperatures. Scientists have said disinfectant tunnels are substantially less important than practicing good personal hygiene and social distancing.
The COVID-19 pandemic has brought about many behavioral changes globally. But where shoppers generally preferred to frequent brick and mortar stores in Dakar, we're now seeing an upward trend in terms of the demand for online food delivery services in the Senegalese capital.
Since lockdown came to Senegal, many locals have started ordering their groceries online. It's a welcome boost for the country's delivery companies. Club Kossam is one of those firms. They've seen monthly sales surge in recent months. Operational manager Lucien Jeju.
Since the start of the pandemic, we've doubled our deliveries. We now do 1,300 deliveries per week. We weren't doing that much at the start, so we are growing, but the pandemic sped everything up.
Club Kassam's sales hit $103,000 in April, double the monthly average of around $50,000 the company saw before the outbreak. They have since hired 25 employees to cope with demand. The firm has also had to find new produce for customers, which they say has helped other local firms cope with lockdown restrictions. These farmers working in a village near Dakar now pick strawberries exclusively for Club Kossam. They also produce mangoes and grapefruits when they're in season. Club Kossam head of supply, Mohamed Sorgo.
Because of the crisis, a lot of markets were closed and the only choice for producers was to sell directly to organisations like Club Kossam. We helped small producers sell their produce because we managed to get all the necessary permits to continue to work, so it has helped them a lot.
Club Kossam was set up in 2016. 4 years on, and with new customers signing up, the company's managers are confident about its future.
And still to come, fashion enthusiasts are now matching their outfits to their masks, and a famous South African DJ is spinning and spreading some positivity across the globe. This is #Africa. Let's now take a quick look at news making headlines across the African continent.
Burundi is expelling its national head of the World Health Organization at a time when politicians are pressing ahead with large election rallies despite warnings against mass gatherings. The government confirmed on Thursday that a letter had been sent to WHO country head Walter Kazadi Malumbo and 3 aides, ordering them out by Friday, while a Foreign Affairs Ministry official confirmed they had been declared persona non grata, without giving any reasons. On May the 20th, Burundi will vote for a successor to President Pierre Nkurunziza, whose government has a history of expelling representatives of international organizations. In 2018, UN investigators probing allegations of rights abuses were kicked out of the country. The United Nations has previously accused security personnel and a ruling party militia of orchestrating gang rapes, torture and killings.
Internationally acclaimed South African DJ Black Coffee is raising money to donate to various charities fighting the COVID-19 pandemic. This through virtual concerts. Just goes to show the lockdown doesn't need to put a hamper on enjoying good music and doing some good in the process.
He rose from South Africa's poorest province to become one of the world's most successful DJs, entertaining millions in dance clubs across the globe. But more recently, Black Coffee has been spending a lot more time at home. Like other artists, he's turned to performing virtual gigs that fans can access via the internet. And he's using the home-brewed sessions to raise money for charities supporting those in need at this time of crisis.
I had a bigger dream of just raising R1 million, and I think we may just raise 600,000. I take that as a big win.
Black Coffee's last home-brewed session was this month, and he says he's now going to try and figure out how to restore his lost income. Like most musicians before the lockdown, Black Coffee made money from live gigs because the digital age has sapped revenue streams from recorded music.
Then I need to kind of like go back to my drawing board now as an artist and see how to really create opportunities, now next time I stream it, to make sure that we earn some money.
He sees some hope that the virtual format could recreate at least some of the vibe from live gigs. But only if fans get better technology, such as virtual reality sets in their living rooms.
And finally, Don't let the lockdown dampen your street cred. Now, fashion lovers around the continent are combining style and safety by wearing colourful masks that match their outfits.
Nigerian fashion designer Sefia Dejamar likes to wear bright, bold colours, and she believes the lockdown shouldn't get in the way of her sense of style. She has now turned her face mask into a fashion accessory. Gold-coloured and studded with sparkling diamante jewels, it matches her floor-length dress.
I have to maintain status quo and remain who I am despite the situation. Another thing is you have to cheer people. They don't need to, people going around in the surgical mask is depressing. But when you come out with a stylish mask or with an accessory such as this, it doesn't seem as though we're fighting a war.
Many African countries have made it compulsory to wear face masks in public. And Sefia isn't alone in making hers look stylish.
Okay.
In Senegal, fashion designer Sophie Zinga has built an online platform selling fashionable masks.
In the beginning of the pandemic, I thought that this was going to last just maybe a few months. Now I do believe that in the next 2 years, maybe, we're going to have to adapt and live with this virus. And, I think as a fashion designer, we're going to have to integrate with each outfit fashion masks, basically.
Here in South Africa, where lockdown restrictions are strict, lifestyle brand Inga Atelier is also working to create masks. The company's creative director said the move made sense from a business perspective, as the mask becomes an everyday feature for the foreseeable future.
And that's it from me, Dumelo Mututwani. I hope you enjoy these images from around our beautiful African continent as we love and leave you for this week. But remember to keep the conversation going online. Our Twitter handle is @Africa_ENCA.